So sometimes my patients come to me and they are female patients who don't have regular menstrual cycles. And that is often a sign of ovarian dysfunction, most commonly polycystic ovarian syndrome. But if a woman is trying to get pregnant, if she is trying to reduce her risk for endometrial and ovarian cancers, it's really important that we have normal menstrual cycle function. When we are evaluating, we can often see some biochemical changes. So we might see altered hormones in terms of the sex hormones like testosterone or progesterone levels. We might see that there's insulin resistance and metabolic dysfunction. When we work on weight loss, especially when we focus on a diet that's built around plants and protein, when we are helping metabolic dysfunction, either with those nutrition changes or sometimes nutrition changes plus metabolic medications like metformin and one of our GLP-1 medications, we will often see restoration of normal menstrual cycles, and that is a good indication that we are probably ovulating regularly, that we are bringing the ovaries back into normal function. Some women like not having regular menstrual periods, especially if they're very spaced out. Some women like not taking hormonal birth control and just knowing that they've never been able to get pregnant before. And so it is important that we are assessing, do you want to be pregnant or not? Because as we lose weight, we might be improving fertility. And so if you've relied on that for a birth control method, which I'll say is not a super reliable path, but as we work on weight loss and improving metabolic health, you might find that you're newly fertile in a way that you weren't before. And so figuring out, all right, is there something else that we need to do to prevent pregnancy if you're not choosing to become pregnant? Looking at this really comprehensively is important so that we don't have unintended pregnancies. And if we are trying for pregnancies, that we're able to get pregnant in a way that is safe and healthy and gives, good long-term health for mom and for baby.